Welcome to DDCP session interview of Dr. Rahman. This is chapter 4. Dr. Rahman, I have a couple of questions for chapter 4. Number 1, what is your additional advice for the next generation of physicians seeking to develop a career in pharma industry?
So I would say that you need to get trained and you need to get experiences. So as you're looking to join the pharmaceutical industry, as we talked in the previous chapter, get the right book and read that, then go and get the right training. But when you're in industry, there are two things that are vitally important: experience and mentorship. So you need to open yourself up to new experiences. For example, when I was working in medical affairs at Merck, there was a question about working with the manufacturing group. I volunteered. And as a result of that, I became the head of product quality complaints in the manufacturing division, which was unique. I was a physician. They had hired me to do these work, and it was something that I had learned on the job. And it's not about having the right answer all the time. It's about knowing the right question to ask. And so you won't know that until you gain experience. And then if you get a mentor, she or he can guide you to get the experience. So learning is mostly about experience. Yes, you need to take courses. Yes, you need to read and learn. But the biggest thing is trying to get the right experience and trying to have somebody who can serve as a mentor to guide you through on your career journey.
Thank you for sharing your experiences in product quality assurance. It is, I think, very, very unique for the physicians working in pharma industry. Do you have any advice to look for the very unique opportunities even within the pharma industry?
Sure. When I think about the people who have been the most successful, I think of a few things that they must possess. Courage is one, because you're jumping into an ocean that you may not necessarily know how to swim in so well, but you will learn. The second thing I think about is intellectual curiosity. You have to be interested in new learning experiences, and you have to be stimulated by those. If you're not, then it's not going to work well. You can have a good career, but you won't be really well served if you're not curious and looking to learn new things. The third, however, is having fun in what you do. And that is an important part of being successful. General Colin Powell, who was chairman of the Joint Chiefs of Staff, said that optimism is a force multiplier. If you're having fun, there is a sense of optimism that develops, and that makes the team work better. And when you all are together with Dr. Seriu, you can ask him. We had team events where we were in Korea or the Philippines. We had team events in England and America, whether running in Manhattan or going to the theater or playing cricket in England or playing table tennis in Malaysia. They were all different things that we did, and it made the team enjoy what they're doing. So you personally need to have courage to take this leap into a new area. You have to be curious. You have to read and learn you have to get comfortable with discomfort. Let me repeat that. You have to get comfortable with discomfort, because you will be uncomfortable as you learn new things and as you grow. So you need to get comfortable with that, and that gets back to the intellectual curiosity. And then you got to have fun. If you're not having fun doing this, you won't be terribly successful, because it is long hours and hard work and many challenges. But if you can have fun, as I said, fun and optimism will be a force multiplier, and you can do more things than even you or the team would have thought possible.
Thank you very much. It is not easy to find fun during the work, but you emphasize the importance of having fun. Is it possible to find fun working in pharma industry easily, or it depends on the leaders?
It depends on the leader. And when we had you working with us, you allowed us a certain sense of latitude. And then I was able to take the group out and, we visited the United Nations. Sometimes when you're dealing with a label between clinical, regulatory, PV, and others, you feel like you are in the Security Council working through a major problem. But there was an opportunity when we were in New York, we took people from all over the world to go to the United Nations. So it's about being intellectually curious. It is about finding ways to connect with the cities that you are in, with the things that you do, and that is how you have fun. Fun doesn't always mean that you're playing ball or you're going dancing, although we've done both of those things too. We went to the Museum of Modern Art. We also went in New York to the Rockefeller Christmas tree. Some people, let's say from Taiwan or Korea who had never been there, or, even some people in New Jersey had never gone to see the Rockefeller Christmas tree. And so those are experiences where you can have fun. But even as you're in the rooms, in the conference rooms doing the difficult work, making a joke, looking for ways to laugh and enjoy the work. You have to enjoy the work. You can laugh sometimes at the end of all of it, the absurdity, the difficulty, the challenges, because you have bonded as a team and you know that you can trust your fellow colleagues. And that's a part of beginning to have fun with one another.
Thank you very much. I like the comment about the fun. It is very important to build a great team, and as a result, we could achieve more.
You remember when we had inspections in Germany or inspections in America? What did we do in the morning before the inspection? We would play Bob Marley music. Don't worry about a thing because every little thing's going to be all right. So Saryu-san and I would go and we would play this music and we'd have everybody sort of just sway a little bit and have some fun. But think about it. There was a deliberate attempt to make people realize that if the two senior leaders in pharmacovigilance were so relaxed that they were dancing and 30 minutes before the inspector arrives, then why should they worry? And that relaxed atmosphere really led us to, I think, really better outcomes than we may have had, were we tense or nervous or worried. I remember we had about 50 people at an inspection in Germany from about 20 different countries. And people just really loved that experience. And you would think nobody loves an inspection, but they really did. Trust me, I'm not exaggerating.
Yes, I remember the morning. Thank you very much for sharing that great experiences at the time of the very serious inspection. I would like to close the session, chapter 4. Thank you, Dr. Ram.
Thank you, Dr. Sari.